It's just a great building. Should I talk? Should I start talking? Okay, well, I'm right or what? I don't know. Are we going live or not? I can't remember. Oh, I thought we were. Okay. I am really excited to be getting my third COVID vaccine. It's been 6 months since I got my second. And my parents are in their late 70s, already got their third a month ago. I'm very grateful for that. But now with full FDA and CDC approval for folks who've had Moderna like I did, it's been 6 months. I am ready to get the booster because, like most Coloradans and Americans, I'm ready to put this pandemic behind us. And I'm very excited to increase my safety and protection.
Governor, you've made it clear in your announcement yesterday and past announcements that you really want as many people to get the booster as they can.
Yeah.
The federal government is still recommending very specific people get very specific boosters. Is your advice to get the booster maybe going against that advice of the federal government? Well,
no, the CDC and FDA guidance is very broad for who should get the booster. It's basically everybody after 6 months for Moderna and for Pfizer, after 2 months for Johnson & Johnson. Now, the way that they phrase it is everybody 65 and up. And if you're under 65 like I am, if you work around other people, which I certainly do and which most Coloradans do, if you work in your own home, don't go out, don't want that extra level of protection because you're not exposed to other people, you certainly don't need to get it. But I think more and more this will be looked at as a 3-course vaccine, just like DTaP is for kids. My kids had the DTaP vaccine, 1 and then 2 and then 3, and that protects you against diphtheria and whooping cough. And this, the data is just off the charts on how well 3 vaccines protect you. Absolutely incredible. I mean, on the data that was just submitted, they studied 10,000 people. 5,000 of them got 2 doses. 5,000 of them got 3 doses. Of the 5,000 that got 2 doses, 109 got COVID. Of the 5,000 that got 3 doses, 5 people got COVID out of 5,000. So really just incredible. All minor cases, by the way, no hospitalization. So I'm excited. I'm excited to get this level of protection, and I'm ready to do it.
But regarding that, very specific recommendations still being out there, do you think this confuses messaging at all?
Yeah, I mean, look, I think the FDA and CDC could have messaged it more clearly, but I think that at least cutting through that is it's for everybody who got it 6 months ago. Certainly everybody who's in their 60s, 70s, 80s, 90s, it's critical to get it. I mean, you're at the highest risk. You always were at the highest risk. And you have the biggest drop-off if you're in your 60s, 70s, 80s in the efficacy of the vaccine. So most important. But of great benefit to people in their 40s like me, people in their 30s, 50s, also of great benefit. Stronger antibodies, stronger resistance. And that's why the CDC and FDA really open it up to everybody who works around other people, which I do, which most people do. So if you have that risk of exposure, they call it a high risk of exposure because you work around other people in your day, teachers, first responders, work in a retail store, work in an office environment where your cubicle is near other people and you're going in. You want the safety that this third dose can provide. I work around other people every day. Will be relieved to have this level of protection.
You talked about ICU capacity yesterday a lot in your in the press conference update on the status of COVID-19 in the state. Is there any sort of threshold that we would have to meet, considering the ICU occupancy levels right now, to maybe institute some sort of statewide public health orders or anything, a mask mandate or anything like that?
Well, right now where we are, we're working closely with the hospitals to try to expand their bed capacity. This isn't where we wanted to be as a state. It's not where we wanted to be as a nation. It's especially frustrating because we have the solution, the highly effective vaccine, right? And if you're vaccinated, you have much less to worry about. Of the 1,100 people in the hospital, well over 850 are unvaccinated. So you got the vast majority unvaccinated. And of the people that are vaccinated that still need hospitalization, it's mostly older Coloradans, and the booster will solve that. In fact, the average age of people who are vaccinated or hospitalized, 73. Average age of the unvaccinated or hospitalized, 54, because you still people in their 30s and 40s who are unvaccinated who have to be hospitalized, intubated, some don't even make it. The vaccine offers a higher level of protection that lasts longer the younger you are, which is why the booster is even more important for people in their 50s, 60s, 70s, 80s. But it's of great benefit to people of all ages, and I'm excited to get it.
All right. Hello, Governor. I'm Kamika. I'm
Hi,
gonna be
Kamika. How are you?
administering your vaccine
Okay.
today. I've been with Denver Health for about 2 years.
Okay.
I've been in the healthcare field for about 25.
Wonderful.
You're welcome to
Thank
MA
you for
Week.
your work.
We're experiencing MA Week this week.
How, have you given a lot of boosters out?
I have.
That's
I've
exciting.
I did testing for a long time.
You were doing the testing
I was
of the
doing
vaccine?
testing.
Oh, wow.
And now we've done a lot of the vaccines.
That's great.
Do you have a preference on which side you're getting this on?
Oh, which what?
Which side?
Probably my left side
Left
since
side
I'm
is what you're
right-handed,
doing?
yeah.
Okay.
And so this is the booster, the half
This is
dose,
the
right?
half dose
That's
booster,
exciting.
yes.
So less for those who worry about being under the weather the next day. It's less than the other two because it's half the dose of it, and it's available for Pfizer, Moderna, and J&J. J&J after 2 months, you need to get another one. You can get whichever one you want. I mean, they all work. So I could just as well get Pfizer right now, but I happen to be getting Moderna. But you do need that third dose for this to have lasting, effective protection.
All right, I'm going to come over to your left side. I'm going to roll up your sleeve. Give you a little cleaning. Not to say you're not.
This is exciting. I'm ready. I got my flu shot a few days ago too. So
saw that.
Yeah.
I saw that.
Which also is important to protect our hospital capacity. And who wants to get the flu? My
3, 2,
goodness.
1.
How about that?
Congratulations, sir. You got your third.
Yeah, I felt it going in, and I didn't even feel
I
it
don't
after
like
that.
for you to
so
feel it.
that was it. Just like a tickle, really.
Exactly.
Thank you so much
I
for that.
thank you very much
Absolutely.
for coming in and getting it done.
I am excited to be more protected, or at least I will be in another 10 days to 2 weeks, which I'm excited. Just in time for Thanksgiving and the holidays, I'll have less to worry
Have
about.
more family come over.
My parents are boosted. We can't wait till it's open to 5 to 11-year-olds, hopefully early November.
Yes.
My kids are 10 and 7, so we're ready to go.
I have an 11-year-old, so I can't wait either.
Yeah, you can't wait either.
I cannot wait.
Yeah. Thank you all so much.
Governor, now that you're boosted,
Yeah.
we need to
Oh, good.
get you your pin to celebrate.
Is it a specific booster pin? I didn't see it. What does it say?
Because I got the shot.
I got it. I'm ready. We're ready. Let's end this pandemic.
Thank you, sir.
Thank you. And I got my card here. It says booster right there. So
sir.
good. Thank you.
Thank you very much.
All right. That was great. Did you have any other questions?
I guess, do you believe that you getting this booster at all confuses your messaging just in the past is all?
So say that again?
Considering just that the federal government still is really recommending very specific recommendations for very specific people, do you think you're...
Well, I'm one of those people because it's for over 65 and it's for anybody who works around other people who got it 6 months ago or so. So again, for Pfizer and Moderna, it's 6 months. So if you got it 2 or 3 months ago, you don't rush in and get the booster. 6 months ago, 65 and up everybody. If you're under 65, if you work around other people, you should get it. What you see is a significant drop off in the protection level after 6 months. And that's what we want to avoid.
Is there any consideration for any sort of like statewide public health orders in the future? I know that you've left it up to counties for the most part in the past, and Larimer, Boulder County. And things
Yeah,
like
well, we have more. You notice, of course, I'm wearing a mask as a healthcare facility. They require masks. Masks are effective. Avoiding large gatherings indoors is effective. The most effective of all of these is the vaccine. There's nothing close to it, higher than 95% full protection against COVID with the booster. The first two are probably somewhere in the 80 to 90% range. It drops off a little bit after 6 months. Nothing else compares to that. These other measures can be important. They can be helpful. But we're not going to be done with this pandemic, and the individual risk won't go away until more people get vaccinated. Thank you.
Understood. Thanks, Governor. Appreciate it.
Yeah, 10 more minutes?
Thank you, Governor.
Okay, I'm ready to be observed.